Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
The Journal of Adolescent Health released a study that reveals a rise in students experimenting with hard drugs at the beginning of each school year. Our next guests are here to give you warning signs and help your teen just say no. Dr. Sue Hubbard is the award-winning pediatrician and medical editor with KidsDoctor.com, and Dr. David Atkinson is with Teen Recovery Program at Children's Health, which is a brand new program. Right?
Yes.
Okay, that's important to say. So, Dr. Sue, this is a very, very tough and scary issue for kids and parents.
It is, and you know, it should be top of mind. As you know, every night on the nightly news and the newspaper, unfortunately, we are in the middle of an opioid addiction problem. And we hear tragic stories even from, you know, people in the news, like the mayor of Nashville's son just overdosed. Right. David Farady's son. I've had 2 patients within my own practice as young adults who had struggled when they were young and have overdosed. So it's a big problem.
Oh, as a mom, I can't even begin to imagine. So, Dr. Atkinson, this is a brand new program. At what age do you see kids begin experimentation with alcohol and drugs?
It's not uncommon to see experimentation start at age 12. The average use in adolescence of marijuana is age 15, and the average first use of alcohol is about a year earlier. But it's not uncommon to see kids using at an earlier age. This is important because when we look at people who develop addictions, almost always they start to use while they're adolescents.
Right, I have read that. So what are you seeing kids abuse most?
Well, we're seeing alcohol and marijuana are the biggest here in Dallas. The opioids is a special concern because of the rate of overdose. The lethality of opioid use is one of the things that makes that a drug that we can't ignore, not even for a second. Yeah, and I think that we also see that the teens are doing some illegally manufactured Xanax has been popping up around the city of Dallas.
There's just so much out there now. So, Dr. Sue, you're a pediatrician. What kind of conversations should be going on during a teen's well check, which they all have to go back to school?
Well, I think one thing, you want to have a medical home for your child so that they're used to their pediatrician. And my teenagers, as they've grown up with me, will say, can we just talk about my blood pressure and heart? I'm like, no, we're going to talk about your emotions. We're going to talk about sex, drugs, alcohol, and sometimes with or without the parent in the room. So these are all conversations that should go on at home as well as with your pediatrician.
And one of the reasons those conversations should go on is because there are underlying causes to drug and alcohol addiction and use most of the time, right?
Yes, one of the things that we see commonly is that there's kids with impulsivity and a little bit of a failure to kind of inhibit their impulses. Some of those kids might have ADHD, some of them might be risk takers. On the other hand, things like childhood sexual abuse that we heard about earlier, that can create a long-term substance use risk.
Right.
Those kids always feel awful and they're looking for a way to boost their mood.
Okay, so Dr. Sue, you know, you've heard, oh, well, all kids do it or whatever. When's the time, how's a parent know when they need to go seek a specialist?
I think many parents really do know in their gut, but if your child's experimented one time with alcohol or one time with marijuana, I think it's conversation at home. But once you see changes in your child, behavioral changes, mood changes, isolation, new friends, grades dropping as we get back to school, those are all red flags that you need to seek help.
And Dr. Atkinson, what does the new program, the Teen Recovery Program at Children's, provide?
Well, we are trying to treat the whole adolescent. We're also trying to treat in the home community. Rather than waiting for the problem to get so bad that they have to go off to rehab or they get in legal trouble, we're trying to head it off before then. And we're not just treating the substance use, we're also looking at all the mental health issues so that that adolescent feels better after they finish the program than when they started.
It's a whole program, and this is really important. As a pediatrician, I know that you...
We're so fortunate to have this now at Children's, and we have psychiatrists there, there's therapists who specialize in adolescents with mental health issues and substance abuse, and you can self-refer or you can go through your own doctor. So there's both ways to get in there.
Oh, so quick question. What is both of your advice for parents if you think your child may be experimenting with drugs or alcohol? What do you say?
I think the first thing to do is to ask them the questions and tell them about the dangers of substance use. www.nida.gov, National Institute on Drug Abuse, actually has some really useful information to tell teens about substance use. The other thing is that you want to be very clear with your teen. That doesn't mean you have to tell them all about your substance use in the past. That is one of the things that sometimes can actually make the problem worse. But if they directly ask you, you shouldn't lie. You should say, I did that and it was a mistake. I stopped because I wanted to keep my life open. I wanted to be able to realize my dreams. And I didn't want to keep wasting my time. I wanted to be out there for other people, relationships.
Anything you want to add, Dr. Sue?
I think you need to listen. Sometimes I tend to talk more. You need to listen more as a parent, and then next, do not be afraid to seek help.
All right. Thank you so much for both of you for
Thank
coming in.
you.
It's a serious problem. Like I said, as a parent, wow, it's something that's really scary. If you're interested in more information, you can go to children's.com/teen recovery for more information about the Teen Recovery Program. You can also follow Children's Health and the Kids Doctor on Twitter and on Facebook.
At Children's Health, we're dedicated to helping today's dreamers grow into tomorrow's doers. With care closer than ever, we'll always be by your side.